Hi there, I'm Bonnie Adam from pathwayshealing.com, and I'm here to show you some acupressure points today. These videos are done by request. I've had a couple of requests for videos for stiff neck and for sore back. So the first one I'm going to show you is a video for points you can use to help alleviate a stiff neck. Now the points that I'm going to show you are appropriate for anyone who's generally healthy and you know, can reach the points and do the points for themselves. If ever you are doing acupressure on yourself and you feel pain or faintness or dizziness or anything like that, please stop. But otherwise it's safe pretty much for anyone. The first point I'm going to show you though is not good to use for people who are pregnant. So if you're pregnant, just skip this point and do the rest. So the first one is large intestine 4, which is a very popular point for any kind of pain in the head, the neck, the back, the whole body. So if you have any pain at all, especially head, face, neck, toothache, even sinus congestion, whatever, you can use large intestine 4. So what you do is you take your hand and you look at this bone here. You know, you got your thumb bone and then you've got this bone at the base of the thumb. And you're gonna go in this soft squishy area on that side of the hand, and you go about halfway down that bone. Another way is just to sort of take your hand and your thumb and put it together, and that highest little bump there that sticks up, when I take my hand like that, you can see, that's large intestine 4. So just finding the soft area between the thumb and the forefinger. And if you find it and start pressing on it, it's usually a little bit tender. So then you know you're on the point. And you just press a little bit, maybe for 30 seconds or a minute, just to the point of tenderness, not to the point where it hurts. If you start to feel like, you know, it's getting too hard to hold on to it or it's becoming tender, then back off, right? And then also you can massage these points a little bit too. So you can massage up and down in there. And you can massage basically until the tenderness goes away, or you know, just until it starts to feel better, or you're tired of working that point. And you can use both sides, right? Do the other side for a while too. Just find that squishy area in there and do pressure or massage on that area, and that will help. And you're hopefully not having to hold your hands up like this for the camera. You can do this down comfortably in your lap. So that's a good point for all pain of the head and face and neck and body, anywhere. So another point that is specifically for stiff neck is called small intestine 3. And I tell you these names so that you can possibly go look them up and find pictures of them later. Or I do have an ebook with you know, diagrams of all these points too on my website. So pathwayshealing.com, and look on the shopping page. But anyway, small intestine 3 is going to the side of the hand, so the pinky finger side, right? And you're basically gonna feel up and down, but there's a bone there, and then there's the meaty area of the palm of your hand, and in between is the small intestine channel, or meridian, right? And you're gonna go in there about a third of the way down from the joint of this pinky finger. And if you've got it, it's gonna be a bit tender in there, so you'll know when you get it. And you can do, there's actually 2 points in here, small intestine 3 and 4. You can kind of do both of them, but 3 is really specifically for stiff neck. And again, you can press, you can work that point out, you know, or work out that whole channel there. And this one's really great. Like I can actually feel that kind of going up the back of my shoulder here, and that's where the small intestine channel runs. So if you really nail them, sometimes you feel like a warmth or a tingle actually running up, you know, your body where the meridian runs. Now I'm probably pushing a little harder than a beginner might want to push, but again, just listen to your body, pay attention, and just go to where your body feels that's releasing. So that's small intestine 3 and 4. If they're both tender, do them both. So there's another one you can do. And you would do the other side as well. Sometimes I take my 3 whole fingers and just dig them both in there and squeeze that area and get that whole thing all at once, right? And wiggle, wiggle, and massage back and forth. So that's something you can try. Another one you can try is lung 7. It's a little trickier to find, so I'm gonna hold my wrist up again. And this time we're going down the surface of the thumb here and onto the bone here on the top of your wrist. Let's see if I can turn it so you can see better. So you're going, and in here, if you run your finger up and down that bone, however it works, you'll find there's a little bump in there. There's a little bone that sticks out. It's called the styloid process. And right up, sort of above that, so closer to your body, not closer to your hand, so above that, there's a little notch almost in there. and you can get that little notch and stick your finger in it and press in there, and that's lung 7. Lung 7 is really great for the back of the head and the neck, for opening up that area. It's also really great for sinus stuff, so you know, if you've got sinus cold, that kind of thing, you can use it for that too. And again, it'll be tender, so, and work a little bit in there and work it out. So those are, and then you would do the other side. So run your finger around, find that little knobby bone that sticks out, and find the little notch. You're actually sticking your finger right in between two tendons that attach to that bone. So, you know, like these points, be a little bit careful. You know, you don't want to be too hard on your poor little tendons. You just want to give it pressure enough to open things up. Now, I have to turn around to show you some of the other points for stiff neck. And I show you the ones on the hands because they're obviously easier to use, because it's a lot easier to do this than to be reaching up and around the back. But I'll show them to you anyway, and I'll try to shout so you can hear me. So you want to, I'll turn around, and I think I'm pretty good. So at the back of your skull, right, you have these two sort of round bumps back there. And if you stick your fingers right in underneath, there's almost like a little notch there. Stick your fingers right in there and dig around, you know, and find tender areas in there. So right underneath the base of the skull on both sides, and stick your fingers in there and dig. Now that's called gallbladder 20. And you can press that one for a while. And these ones actually are kind of nice to do if you're lying back on a bed, because then you can, you know, relax back and you can even kind of, you know, wiggle your head up and down and try to loosen that area up. Another good point for sinus congestion too, and for the stiff neck, and for benefiting the eyes. It's meant to help a little bit with clearing up your vision. So if you got allergies and your eyes are all goopy, try that point too. And then of course, I'm just going to slide my top down there. At the back of the neck, you can find the biggest bone at the base of your neck. So you've got 7 vertebrae in your neck, and the one at the bottom is a big one. And find that big bone. And the thing is too, it's kind of the last one that moves when you turn your head. If it doesn't move, then you're onto the upper back vertebrae. So find the one that still moves back and forth when you turn your head, and it's the biggest one. That's right underneath that point. You can stick your finger in a little bit right underneath the vertebrae, like between the two vertebrae, and that's called dew 14 or governing vessel 14. Another big kind of opening, relaxing point. So get in there, find that vertebrae, turn your head if you have to, like, okay, that one moves, that one doesn't move. So this is C7, the vertebrae I'm talking about, and get in there and just gently massage in between there. And then in between every vertebrae in your back, there's an acupuncture point, pretty much, starting at the top there. So anywhere, as far down as you can reach, I'm just going to take this right off, there are points. So if you go find the bottom of the vertebrae again, and then just go out an inch or two on each side, then you're in an acupuncture point. The first one being bladder 11, and then next one being bladder 12, next one being bladder 13. So you could just go along, press, then go down to the next little space and press, and the next little space and press. And it depends how far you can reach and how flexible you are, or have a friend press a little bit there too. But if you're having a friend do this, just be sure that you tell them when to stop. Like, okay, that's enough pressure now, you know, communicate with them. So press and press and press. And again, you would hold those maybe a minute or so. And then another one that's really helpful is gallbladder 21. So that's right on these trapezoid muscles here. And they come down on either side, and they're always very tense. So about halfway between the base of your neck and the tip of your shoulder, there's a point called gallbladder 21. And you can either just sort of press down into it, and it'll be sore because we're all tense there, or you can kind of take your trapezius muscle and pinch it. So whatever works for you there. You can pinch it, or you can press down into it with your fingers like that. And those are the upper body points for stiff neck. There are a couple of points on the foot and ankle, believe it or not, that also help with stiff neck. So I'm going to show those to you now. Hi again, I'm here showing you a couple points on my foot here. So I'm kind of balanced with my foot up on my massage table. I hope I don't fall over on you. So, and my feet, sorry, my feet are a little bit off shape because I was born with club feet, but I think I can still show you what I'm looking for here. So the point we're looking for is called bladder 60, and what you do is you find your ankle bone here on the outside of your foot. So this is my baby toe in case you can't see that clearly. And I'm on the outside of my foot. And I go to that, sort of just the tip of that ankle bone, and you go right back behind it. And behind it is right between the bone and your Achilles tendon. There's a nice soft channel again in there, and that's where part of where your urinary bladder channel runs up the back of your leg. And you stick your finger in there, or your thumb, whatever you got, and press in there, and that's bladder 60. And especially if you have used the small intestine point on the outside of your hand, you know, the one by your baby finger, and you use bladder 60, together those two open up the whole side of your body. So if you do those in combination, that's really going to help you. And I'm going to switch feet here, 1 second. Get my other foot up. There we go. And this is the inside of my foot, so the arch of my foot, my big toe there. And on the inside of your foot, there's another point that's the same thing. Basically, you're going to find your ankle bone and then go right behind it. And behind there is kidney 3. And kidney 3 benefits the knees, the back, the neck, the whole body, and it helps to raise energy. So even if you're feeling a little tired and sluggish, you can do kidney 3. And a really cool thing is, if you want, you could sort of pinch the whole area. So kidney 3 and bladder 60 at the same time, because they're basically the same place, but just one's on the one side of your ankle and the other one's on the inside of your ankle. So you can just kind of squeeze there, and that will benefit the whole back, neck, and raise your energy up and just clear things up for you that way. So those are some good points for you too.